with your raw materials for your RNA products. There are a couple of some audience questions here that I want to tackle. So what matters more to you? What's in the vial or what's in the process? I feel like this could be a trick question. Do you guys have any?
I hope I'm interpreting the question right. I mean, at the end of the day, what's in the vial is what the patient sees, so that it should be, everything is designed around that. You know, of course, your process and your materials get you there, but you know, at the end of the day, what's in the vial is how I would answer it, if I'm unless I'm missing something in the question.
Yeah, I don't know if the vial is meant to be the final therapeutic or if it's a supply, right? The supply of something. A material.
I would assume it's the final therapeutic.
Yeah.
That's a common cGMP thing. Is like, how much do you try? Oh, I put this like toxic thing into the process, but I removed it later for.
Yeah.
And there are some things that you just shouldn't be doing that with, but you know, provided you can show it's in and it's out and, you know, below safety levels. But you have to think about your labeling as well. I mean, consumers, other, you know, decision makers in industry, people who are buying your product or allowing it to be used in the country, do look at what, so if you put that toxic thing in your process, even if you remove it, it's probably going to wind up on the label, and that may impact your ability to sell it. So ultimately, I definitely agree with Greg that your vial, like what's in your vial and what's safe for the patient is paramount. But those other things can't be, it's both. Like, you have to consider the implications of what you're doing for later.
Yes.
So the consumer, like, that is actually in the vial, even though you know it's not. It's in there.
Yes.
It's on the label.
And at the end of the day, and maybe this is where the question was leading, is you have to defend your control strategy. So just because you don't have something in your test panel, if your test panel is not appropriate, then you may not be picking it up. So yes, your process is part and your analytical characterization and defending, why your tests represent what's in your vial, is all part of that.